So today we're going to be demonstrating an EGV cannulation. So we're just going to make sure that we have our correct PPE gear, which is our gloves and our glasses. Next we're going to make sure that we have the right equipment, which is the alcohol swab, the lower plug, a tegaderm, a saline flush, and our 14 gauge cannula with a pre-filled saline flush attached to the end to help prevent any air emboli upon insertion, and the saline before placed in the syringe was checked by myself and by my offsider. Next we're going to gain consent from the patient if they're conscious. If they're not, then that's also going to be a little hard. Next we're going to turn the patient's head to the side so we have a clear view of where we want to cannulate, and then we're going to want to distend the jugular vein. So we can either press down on the liver to induce the hepatojugular vein reflex, and then we can also place the patient in the supine position and raise their legs, or we can press down on the supraventricular space, which will help also distend the vein, or if the patient is conscious we can ask them to bear down, which will help with caution vein. Then with good vein distension, we are going to clean the vein site. So we're going to start in small circles and grow larger to ensure good sterility. And then with good sharps etiquette, we're going to remove the cap, so sharps out, and then we're going to traction and distend the vein using the C-grip. And then we're going to warn the patient, so sharp scratch, and we're going to insert the cannula at 15 to 20 degree angle, and we're also going to place it in the upper third of the patient's neck to help prevent any tension pneumothorax. So we're going to also apply negative pressure to the syringe plunger as we go in, which will help to confirm that we do have flashback. So we're going to go in at 15 to 20 degree angle. And once we're in, so we do have flashback, and we're going to flatten and advance the needle about 3 millimeters, and then we're going to advance the cannula. Okay, so we're going to occlude the vein and then remove the needle and then place it directly into the sharps container. And then we're going to get our lure plug. Attach it. Then we're going to get our flush, which is 0.9% sodium chloride and 10 milliliters, and it expires in 2020. Make sure that there are no air bubbles in it. And then we're going to attach it to the lower plug, aspirate to make sure we are in the vein. So we do have, we are in the vein, and then we're going to flush at least 5 milliliters to ensure that we have a patent line and that there is also no infiltration of fluids to any of the surrounding tissue. Flush, and then we can secure it. And now would be a good time to document the date and the time that it was given and the size of the cannula.